some time ago, our club passed around some paperwork regarding Greenville hospital system and appeared, I don't know a gentler word to say than take over the ambulance system. So this issue continues to grow, and I think we all want to have the best to continue to have the best healthcare system in the world. And I have invited myself personally Tom Barilovits. I've talked with him for a number of hours, and he's going to update us on some of the issues, times of meetings that we can attend, and other avenues to make our wishes known. In fact, after the meeting is over today, if you would like to talk to Tom and give him some contact information, he will be available. I know that from what I can read and gather, the healthcare system is designed at this point to reduce to 20 main systems. And all I can think about is the atrocities endured by veterans and veteran hospitals, and the poor and fatally slow care of nationalized healthcare systems of England and Canada. I'm so grateful I don't live there. Although they're good people and they speak English when you travel, that's kind of handy. But anyway, so I would like for you to talk to Tom, and if we have time, if you have a question, please keep it in a question format, but we're going to kind of hurry through this.
Thank you. Appreciate it. Hello, everybody. Can everybody hear me? Yeah, my name's Tom Barilovits. I grew up in Simpsonville or Malden and went to Malden High School, attended Clemson, and then I got an MBA from the University of Chicago. I've run some small businesses, non-tech and tech businesses, worked for large corporations, and I did management consulting for the IRS. We reorganized Internal Revenue Service in the year 2000, the entire IRS. So that's my background. Before I cover the main topic today, and this is what Stacy Shea was saying earlier, I'd like to say a couple of points. Simply put, we cannot just elect good people to federal, state, and local offices and expect utopian outcomes. That's just fantasy. We must all actively and personally communicate with, manage, assist, and inform our lawmakers, public commissioners, and other public board members on a constant basis. Our failure to do this is the root cause of many of our problems today. If we don't do this, others will. They're called lobbyists. Okay. We all must be actively engaged with our lawmakers. So given that, that's why I got involved in the first place on a few issues I'm working on. The main one is the GHS hospital takeover, statewide expansion, and monopolization plan. They call it privatization, but taking something for nothing should not be called privatization. I first got involved with this with the GHS EMS takeover attempt last year. After we got involved and a bunch of other people got involved, GHS finally backed off. If they had gotten hold of the Greenville County EMS system, they would have had total control over a lot of emergency room patients coming into the hospitals. So let me talk to you about the Greenville hospital system, give you a little background. Founded in 1947 by a 1947 state law as a taxpayer-owned political subdivision of South Carolina, Greenville Health System has grown into the largest hospital system in South Carolina, 15,000 employees, $2.5 billion in revenue, 8 medical campuses spread across 6 counties. Over the last 5 years, GHS has been on a buying binge, acquiring numerous medical clinics, outpatient centers, all kinds of stuff, and then also 2 financially struggling hospital systems in Oconee and Lawrence County. This shopping spree has given GHS a monopolistic 70 to 80% market share throughout the upstate. GHS is just, all that buying binge has pushed GHS into financial trouble. Now they want to cut back on services in Greenville and reduce the number of doctors in Greenville County. This is not their ultimate plan. Their ultimate plan is to grow even larger. Using one-sided lease and control agreements, GHS executives are now implementing a plan to take complete control of this multi-billion-dollar taxpayer-owned hospital system. A lot of people don't know that. The Greenville County, the Greenville hospital system, or the health system, is owned by the taxpayers. Using a 100-year, $1 per year lease agreement, that agreement turns over GHS assets, operations, and all healthcare professionals over to a private corporation that is unaccountable to upstate citizens and taxpayers. GHS hospital executives tell us that they must implement this takeover multi-state monopolization plan due to changes in healthcare regulations like Obamacare. Once they take this whole system private, their plan is to expand the system all across South Carolina and into Western North Carolina. That's per their documents. Ironically, though, it was the hospital executives who lobbied for Obamacare through the American Hospital Association. They helped write, promote, and pass Obamacare. Hospital executives via the American Hospital Association. You can look it up, go to my website, you'll see it. This takeover expansion plan will eliminate any real healthcare free market competition on a massive scale, which will in turn hurt patients, healthcare professionals, small businesses, local communities, and especially the poor via high cost, low quality healthcare and fewer patient options, and actually lower charity care. As hospitals get bigger, they tend to do less, quality goes down, prices skyrocket. Hospital executives have said that hospital consolidation, when all this hospital consolidation dust settles across the United States, the 5,000 hospitals we have today will be merged into 20 super regional hospital systems with 250 hospital systems and thousands of clinics per system. 20 systems will be easier to nationalize than 5,000. Think of the VA hospital system on steroids. This is the unseen massive underbelly of Obamacare. Healthcare spending has been growing at an annual rate of 2.5 times that of inflation. From 2003 to 2013, family healthcare costs have grown by a whopping 120%. Experts say that medical expenditures have topped $10,000 per person per year and will continue to grow faster than inflation for the foreseeable future. Lack of real healthcare competition is the main driving force behind skyrocketing healthcare prices. It's not the insurance companies, it's the large hospital system executives that are merging these systems, jacking up prices, and walking away with millions. If allowed, healthcare could transform into a high-quality, low-cost, competitive, decentralized marketplace full of outpatient centers, specialized hospitals, and clinics. When you get a chance, go to my website or go online and look up the Oklahoma Surgical Center. There, that place has a lot of surgeries going on, and they actually publish the prices of their surgeries. It's pretty amazing. That's what we could do in the future. Mega hospital system executives across the U.S. are doing everything in their power to keep the $3 trillion healthcare industry under the bureaucratic control by successfully lobbying for state and federal laws that are crushing competitive free market healthcare. Today's hospital executives will be long gone with their millions just a few years from now, leaving everyone else to suffer under a healthcare mess made possible by today's decisions. Today, healthcare executives are raking in huge salaries and massive retirement package. This is happening all over the United States. Even with Obamacare, and they're crying wolf about or they're not getting enough revenue, hospital executives are making big bucks. CEO Michael Reardon of GHS earned $1.4 million a year, and he has a secretive $41 million deferred compensation golden coffin deal. That's called a split dollar loan agreement. Nobody knows about this. I got it here for you. Why are we paying the CEO of a charitable nonprofit organization those huge amount of money and giving them huge retirement packages? It doesn't make sense. Why do they do it? Because they can. Nobody's watching. Today's healthcare executives call their takeover plan privatization. How can taking something for nothing by a $1 per year, 100-year lease be called privatization? If GHS executives want control of a multi-billion-dollar taxpayer asset that's ours, they should pay for it. GHS executives should work with citizens and state legislatures to change the state law so we can all truly privatize GHS by auctioning off GHS into 2 to 3 competing hospital systems. The billions in auction proceeds should go back to the upstate taxpayers who are current owners of GHS. To stop GHS' current takeover plan in its tracks, we need citizens to call and write to state legislatures, GHS board members, and the news outlets. Tell them to support legislators like Gary Smith, Mike Burns, Dwight Loftus, and others who are trying to stop this unconstitutional takeover plan. How many of you know in here that there's a state Supreme Court case going on about this, current case? There was one last year that was rejected by the state Supreme Court. This one's going on right now. It'll probably be adjudicated in August. But GHS executives who said they were going to wait until the state Supreme Court ruled on it before they move forward are moving forward with their plans. That's happening right now. Unless we start getting involved directly, calling those GHS board members right now, getting more people involved, this is going to keep going, and I'm not too confident in the state Supreme Court right now. So without your help, this will go forward. We just got to get in there and put our foot down. In 1996, GHS tried to merge with Anderson Hospital and Spartanburg Hospitals. They could have done this without any voter input, but somebody got together and finally convinced them to listen to a referendum where voters in Greenville County voted down that plan 4-1 in a referendum, and the board members backed off. We can do this again. We just got to put our foot down and say, hey, more people got to say this is not good. We don't need Obamacare socialized medicine here or across the whole state of South Carolina into western North Carolina. So I got involved with this. I'm just a nobody. I went to the GHS board meetings. I've been threatened by the GHS police for trying to speak out. Did you know that GHS has a police force? 2013. They have jurisdiction over any site they lease or own. So just keep that in mind. I've gone in front of GHS board, gave a presentation. They completely ignored me and voted 12-2 to go forward with their plan in December. They're churning down that road right now. So get in touch with your legislatures, get in touch with your county council members, start making noise, because unless we start making a lot of noise, this is a done deal. Greenville News is almost, and maybe this is controversial for some of you, Greenville News is almost like the PR department for Greenville Health System, hands down. They don't write hardly anything negative about them. I even told one of the reporters about the $41 million split dollar loan agreement that gives Reardon millions later on down the road. They won't publish it. It will simply not publish it. So unless you guys get involved, start clamoring, even WORD 106.3 radio station will not actively talk about this. They shut me down every time I call up. So unless we all start making a ruckus about it, I don't think we can stop this plan. So get involved, and there's cards back here. There's a website back there with the websites on the card. So you can contact me afterwards if you want to get involved with this. Thank you.